Today on Border Region TV, we're at Monaghan Hospital, which is part of the Cavan Monaghan group of hospitals. We're looking at the gum clinic for STIs, and we're going to speak to Dr. Justin Lowe. First of all, Dr. Lowe, what does GUM stand for?
GUM stands for Genital Urinary Medicine. It's a very widely used term in the UK. It means sexual health clinic, really, in lay term, yeah. And that's the official term that we use, yeah.
And this clinic is has been open now in Monaghan for how long?
Now, we have opened this clinic since December 2011, so it's been running for the last 1.5 years now, yeah.
And is there a charge for people to avail of the services here at the clinic?
It's totally free of charge, and anything from consultation all the way to medication. We dispense our medication. It's all free of charge, and our clinic is funded by this group called CORD, which is European Union funded initiative that is funding this clinic. It's a cross-border collaboration, yeah.
So you could invite people down from over the border as well to use the clinic services from Fermanagh, Tyrone, Armagh.
Anyone is welcome to the clinic. We don't check your nationality. We don't see your GMS card. We don't see medical cards. So anyone that checks in, all we need is just name, contact number, and that's it. And they'll be treated the same regardless of nationality or place of origin. Yeah.
It's one of a number of clinics that you run around the country. Where are the other clinics based in?
We have 4 clinics running at the moment. This is one of them. We have 2 in Dundalk, based in Louth County Hospital, and we have the 4th one just opened a few months ago, based in Drogheda, in the Our Lady of Lourdes Hospital. So there's 4 clinics running together, and when somebody calls us for a booking, they can choose whichever clinic they wish. Sometimes they may not like to come to a clinic if they're from a small town. They don't want to be seen coming to an STI clinic, so they can choose whichever clinic they want. Yeah, it's up to them. Yeah.
And you were saying the one that you run in James is you would often see people from this part of the country and from Meath and Louth going up to that one. Maybe they're not aware that this one's available in Monaghan.
That's right. Yeah, I've got a few colleagues working in Dublin, in James's, and in Baggot Street. And according to the Baggot Street statistics, 65% of their patients come from the northeast. Yeah, so we are hoping to capture that number here. Yeah, so I'm hoping with more exposure, people will be more aware of the clinic here, and they'll start booking into this clinic instead of going down all the way to Dublin or up all the way to Newry. So if there's a local clinic here, make full use of it. Yeah.
So can you take us through the process of what happens when people make the first approach to the clinic? We're going to put the number up on the screen now, which is the mobile number which you contact this clinic on, and can you take us from there?
Now, it's very simple. All they need to do is just call that number. Sometimes it goes to the answering machine. Sometimes one of the nurses will pick it up. All they need to do is just to express their interest in the clinic, and we'll try to facilitate an earliest possible clinic. The waiting list is not long. Unlike any other HSC clinic, our waiting list is usually 2 to 3 days max. Sometimes we can even see on the same day if necessary. Once they are checked in and given an appointment, they can present themselves to the clinic. From the time they are checked in at the reception till they see a doctor, till they get all the tests, treatment, provisional diagnosis, and including counseling, it all takes less than 2 hours. It's very short. We've done a survey recently to look at the satisfaction level in this clinic. The satisfaction is 99%. Everyone's quite happy. And what's more important is that 100% of our patients here in Monaghan get seen from the time they checked in all the way till they leave the clinic in less than 2 hours.
And if they do have a problem, do they have to take a prescription and go down to the local pharmacy, or did you see you supply the actual medication here?
Now, we take confidentiality very, very highly here. It's very important to be fully confidential here. So in order to provide a fully confidential service, we don't even need to give them a prescription. We dispense our own medication here locally, so they don't even need to bring a prescription up to a local pharmacy. Yeah. So everything is done in-house, done in this 2 hours, all done here, and there's no need to contact anyone outside the clinic here.
And in speaking to you earlier, you pointed out that the clinic is also mixed in with an orthopaedic clinic, so anyone sitting in the waiting area will not be identified as wanting to attend the GUM or the STI clinic.
That's right. When we were starting this clinic, we made this a very, very important feature. In the old days of STI screening or gum service in the country or in the UK, it's always somewhere obscure in a hospital, in some corner or in some evening clinic. So people get kind of secluded from the rest of the world in the hospital. Yeah. So in order to make this as mainstream as possible, we run our clinic in a main outpatient department, and also sorry, the phone is ringing. So we run our clinic in a main outpatient department. We share the waiting area with a lot of other clinics. Today, for example, we have the general medical clinic, we have the warfarin clinic, and also we have the ENT clinics. So when they're waiting in the waiting area, you could be seeing any of us, not just the gum service, so they can remain totally anonymous coming to the clinic.
So someone comes out and just calls their name and no one knows what they're going in for?
No one knows, yeah. So it could be an ENT service, could be a warfarin clinic, nobody knows, yeah.
Now, would you encourage people to use the clinic even if they do not feel they have anything wrong? Like, say they might have a new partner and they want to get checked out, or they want to go through the process before maybe they would get a problem, and then when they have, they'll know what way it operates?
I think that's a very important point, because if you think about STI itself, take chlamydia for example. 75% of female who gets chlamydia with no symptom at all, and half of men who get chlamydia with no symptom, absolutely no symptom, and they could be passing on the infection without knowing they are passing on an infection actively. So it's important to get screened if you are changing partners, if you suspect any infection at all, even you have no symptom. Come in here, get screened, is totally anonymous, free of charge, and we can sort it out if you have any infection. Most STIs are treatable. The important thing is to pick up the phone and call us. Yeah, that's the most important first step.
And can you take us through the range of STIs that you deal with here?
Now, the majority of cases, of positive cases here would be chlamydia. It makes up for about 15% of our diagnosis here. Then second to that is genital warts, which is very common, and we see occasional gonorrhea cases and sometimes syphilis, and in very rare cases, even very severe infections like HIV, we can diagnose it here and refer to appropriate service if necessary. But majority, I would say 99% of the infections we see here are all treatable, simple infection. Important thing is to make the first step, come into us. Yeah.
And this service here at the hospital is under an annual review, I believe. So if it's not used, we could actually lose it.
Yeah, it is currently funded by the European Union under this initiative called COT. And we are under annual review. And by April next year, the funding will run dry. And that's when we are hoping to switch the funding from European Union to HSC. Now, it's very important that we maintain and increase the numbers that we have here. If we don't have the right numbers, HSC might cut down the clinic service and might even eliminate the clinic totally, if we don't have the number. So it's very important. We have a local service here in Monaghan. It's very important for local people to make full use of it instead of going down to Dublin or going up to Newry. Make full use of the clinic here, and hopefully we can continue providing the service beyond April next year. Yeah.
The actual treatment itself, or the test, what does that entail? Is it a blood test? Is it a physical examination?
It's very straightforward. If you have no symptom, it is as simple as just a urine sample and a blood test. Urine sample is to check for chlamydia and gonorrhea. Blood sample is to check for HIV, hepatitis B and C, and syphilis. That's our standard screening. If they have any additional symptoms that warrants further testing, we can provide that as well. And also, what's important here that makes us different from a routine GP service is that we have our own lab, in-house lab here. If you have symptoms, we can take a swab. We can give you a provisional diagnosis within 5 minutes here. That's the biggest difference. And sometimes we can provide treatment the same day as well. So that's the service we are talking about here.
And would you find a lot of couples come together for the service?
We have quite a few couples coming in together, but majority of our patients are individuals. Yeah. If they come back with any positive results, sometimes it's necessary to contact trace and bring in the couples or their partners for further testing and treatment.
Dr. Justin Lowe, thank you for talking to us today on Border Region TV, and we hope that people will take up the service and get screened, even if they don't need it at the moment. In the future, if they do, they'll know how it operates.
Thank you very much, Martin. Thanks for your support, and remember, make full use of the service while it's still available, and hopefully we can continue providing the service beyond April next year.
This is Martin Markey at Monaghan Hospital for BorderRegionTV.